I'm going to record it anyway, just in case.
All right. Good call. So is everybody excited about the giant donkey that's been imported into Australia? Are we all sick of that? I think I've had it shared to my page now about 7 times.
And we're live on Facebook.
I've had a lot of emails from everybody making sure I've seen it.
Yeah, I know. Everybody was talking about it today. They were like, so is he the same as Susanna? It was all at our side saddle clinic today. They all wanted to know how he compared to Susanna.
Mm-hmm.
I said, well, I think he might be distantly related to her. Oh, well, it's good promotion for donkeys.
Oh, very, very. He's a nice bloke. I've been in touch with him for years.
Who, David Scholl?
Because he's got about 4 of the mules that were bred from our fallow.
Okay.
Yeah.
Collecting them.
Yes. Loves them so much. So he brought this one in.
Do we want to wait for anyone else, or do we want to start and just if other people turn up, we
Just give it you can give it a couple of minutes. Because it's like literally bang on 8.
Sure. What I did do, Chase, and it's not critical at all, is I sent you an email with a copy of a very short video that is part of that, part of this presentation. It's not a critical video, but I sent it to you because I have not much faith in technology.
Right. Yes. Okay. So what would you like me to do with that? Do you want me to play that at some point?
It's possible, yeah. So I have it as part of this PowerPoint, but if I have too much trouble getting it to play or navigating flicking between screens, I sent it to you so you had it. But it's far from a critical piece.
Do you want me to send it to you, Keith, because you've got the master computer?
Sure.
Which email should I use?
Either. Reactor's fine.
Okay.
But I've set this up to share screen, so you should be good.
Yeah, and I appreciate that. I just have, I've used lots of technology in lots of different ways in lots of different countries, and as soon as it involves technology and video, you can almost guarantee it will fail at some point.
I've sent it to you, Keith, so hopefully you'll get it.
All right.
As I said, it's not critical. It's just
well, we should
something I
be
thought
able
was
to
interesting.
play.
That's all. And
No.
So I'm just going to go and do the whole share screen thing. Apologies if you all disappear a little bit. Can you see that okay?
Keith's typing at something.
Sorry. No, I'm not sharing screen, so it's okay.
No, we can't see anything.
That's what I wondered. Okay.
Oh, hang on. Oh, no. So maybe I need
permission to do that.
Oh, no. B is joined. Who's
sharing options? So anyone can share as long as it's one person at a time.
Okay. All right. Let's just see if we can get it to a point where you can see. And yep. Cool. See what happens. Okay. What about now?
Yeah, something happened.
Yes.
Yep.
There we go.
Excellent. I like it when something happens. Okay. Yeah. Okay. So, yeah, there we go. All right.
Look at that.
Look at that. It worked. This is actually my first time using Zoom, so that was the other reason I thought it could be a little clunky for me. But actually, it seems pretty seamless. So I'll crack on in a second and go from there. So firstly, I suppose I just wanted to say to you, thank you for giving up your Saturday nights and coming and having a discussion about donkeys and their dental care and listening to what I have to say. I clicked through a couple of these slides just to get them out of the way and see that they're going to work. Yeah, okay, that's fine. Don't worry about all that stuff. At the risk of offending maybe someone here, it's not my intention. This is a good bit of science, and it's a recent piece of science, and it looked at the skeletal differences between donkeys and horses. And one of the things I wanted to do, Keith, do you guys have the ability to, do you have text fields in this with Zoom? Can you ask questions and answer questions in the?
Yeah.
Yes, and we have a chat. Yeah.
You have a chat. Yeah. Okay. So this is my query for you guys. If you can hear me and see this, is the next slide is going to show you two skulls. One's a donkey and one's a horse. All right. So we're going to call the skull on the left A and the skull on the left B. And what I want you to do is just put into the text field whether you think A is a horse or a donkey. Don't spend too long on it, and don't stress if you can't type it in the text field. It's not that critical. I'm just interested to see whether you think A is a horse or a donkey. That's really the question there.
Which one's A? The one on the left.
The one on the left, the darker of the two skulls, if that helps.
The one that's
slightly different coloured.
The one that says
So
B.
is that the horse or is that the donkey? So if you just tell Keith whether you think it's a horse or a donkey, and then I'm just interested in the answers, that's all. And I'll cheat, Keith, and I'll rely on you to feed that through to me because, as I said, I haven't navigated Zoom before.
So at the bottom on the screen, you'll have some icons on the bottom, and one of them says chat.
Yeah, because I've got PowerPoint on. I can't see.
Maybe,
I can.
Right. So
because there's only a few people, because it's a small group, I was just thought you might be able to give me some organic feedback in terms of
if
you can see the answers.
So
how we went.
Ruth said donkey, Chase said donkey, Dee said a horse, I said a donkey, Pat said a horse. This is one on the left.
Okay, so, and that's really all I wanted from the group, even in a group like this, that it's a mix. My point is the results are mixed, right? I don't really care who said what. My point is that results are mixed. It's not quite clear cut whether it's a horse or a donkey. So in actual fact, this is an excerpt from the paper. And so the one that you just looked at was this one, if you can see my cursor. So it was in fact a donkey, and the other one is in fact a horse. And the skeletal differences in the skull are shown over here, and you can see they're actually fairly minor differences. Probably one of the more prominent ones is actually right here, where you'll see this increased or decreased width in this region of the skull. But really, the reason I put that up is because it's good science, it's recent science, and it just highlights that while donkeys are not horses in any stretch of the imagination, dentally, they're actually very, very similar. And so we're going to talk predominantly about donkeys, but we could interchange that a lot with the term horse. And so that's not meant to offend anyone who's into donkeys. It's just meant to make it easier, to mean that there are a lot more resources you can access when you're trying to figure out what's important about donkey dental care. So they are unique individuals, however, donkey. Right? They are special.
Poor Shinto.
Well, you know, he's closely connected to famous people like the Gallaghers. And there are some things that we know are important about donkeys when it comes to distinguishing them. So, I mean, again, we're not going to labour the point here, but this isn't a happy-looking donkey in this slide. You know, I often say with donkeys that they're gentle creatures who are very easily offended, and they have very long memories. So you do have to have a very different approach when it comes to performing dentistry in donkeys, but the anatomy is pretty similar. Again, another one, this is a donkey we'll see again later. This guy's name was Clyde. And again, I'm doing my best here to convince him that it's a good thing, but his body language says very much so that he's there, but he doesn't really want to be there. Fair enough? Yep. Yeah, absolutely. There is another thing that distinguishes donkeys from horses very clearly. Anatomically, but again, not going to be something that we're going to use in terms of dentistry. They're not the only animals who use their ears to communicate how they're feeling and what they're thinking. The dog in the back there is mine, that's Ruby. and it's pretty obvious what she thinks right at that point. She just groaned from the background. You wouldn't hear that, but she did. So this is the anatomy of what we're talking about. This is a side-on view of a donkey or a horse's skull. And as an overview, we've got 6 cheek teeth, which are a mixture of premolars and molars. The only anatomical difference between there is no anatomical difference between a premolar, these 3, and a molar. The reason they have the different classifications is because a premolar has a deciduous tooth that comes first, whereas a molar just develops as an adult tooth. But in terms of the actual structure, they're all the same. Some donkeys are going to get teeth here. These are called wolf teeth. They are actually the first premolar. And some donkeys, particularly males, are going to get this tooth here, which is a canine tooth, which is for fighting. And then we come to the front, and my cursor there. We've got the incisor teeth, which are for prehension or picking up grass, biting off grass, etc. This is a skyline shot. So it's as if we took a donkey and then we were able to open their head like a flip top head. So their bottom jaw's here and their top jaw's above it. And the anatomical importance of that is that donkeys, just like horses and mules, their upper cheek teeth are wider than their lower cheek teeth. Their upper jaw is wider than their lower jaw. And they have anatomical differences between the upper cheek teeth and the lower cheek teeth. So the upper cheek teeth have extra tissue in them. The extra tissue has a name. It's called the infundibulum, and there are 2 of these, one in front of the other. They're a little bit hard to see on this image, but they would be here and here in this tooth. And they make the tooth about 30% wider than its equivalent on the bottom jaw. So between the wider tooth and the wider jaw, basically that's an anatomical adaptation over about 50 million years to allow these animals to graze and have a broad chewing surface that can slowly wear away so that they can eat a really coarse diet, So this couple of images that hopefully you can see there, this is a cheek tooth that's been cut in half. It was a cheek tooth that was removed because it was diseased. So there are some issues with it, but it should look pretty similar to the image on the other side of the screen. And that image is from a veterinary anatomy textbook from the early part of the 20th century, about 1905 or 1906, this textbook was written. It's a textbook on dentistry in animals, and this image is from that, showing the anatomy of an upper cheek tooth in a horse or a donkey. So they did know a lot about dentistry going back 100 or 120 years. What's happening in this particular image, there are 3 tissues that you need to sort of think about, mineralized tissues, when you're thinking about your donkey's teeth. And those 3 tissues are enamel, cementum, and dentine. Each of those form different parts of the tooth, and they have different densities and a different color. And just like our teeth, enamel is not a vital or a living substance once a tooth is in wear, once a tooth is in use. So enamel doesn't really have a capacity for repair, is why that's important or how that's relevant. But cementum and dentine in a healthy tooth are alive. And in this tooth, which is a diseased tooth, what you're seeing, if you look at this area that I'm hopefully highlighting with the mouse there, this is where the root is or would be. And you can sort of see that the color changes just where I'm highlighting. And that area above it is layers and layers and layers of thickened material. And that's because the roots are covered in cementum. Cementum is still alive. So although the tooth is diseased, infected, and in fact dying, the body's response to that is that these cells produce more cementum. It doesn't work, but it's the body's attempt to try and overcome the infection and retain the tooth in the body. Here, where the 2 arrows are highlighting, you'll see that this should be a canal here, and that canal is narrowing. So what's happening is this canal would normally contain the healthy blood vessels and the nerves within the tooth, but because of the infection, those tissues have died. And what we have here, this narrowing, is an impingement on that tissue. So that's exactly what you get. It's the pressure that kills teeth, not the infection most of the time. So if we move on, this is just going to overlay another cheek tooth from the upper jaw, also cut in half. Again, just to highlight that A, it looks a lot like the image on the other side, and B, just to kind of briefly, you know, I don't expect you to remember it all, but just to look at the anatomy. So we've got the roots at the top, the chewing surface at the bottom, that infundibulum that's in the center. This is the beginning of it here, and it's highlighted by the sort of purple or the, let's say, pink line outline. And then going outside of that, that's where we're going to have our nerves and blood vessels. And then outside of that, again, we've got the cementum, which is the attachment layer for a tooth. So cementum is the layer to which the periodontal ligaments attach, and the periodontal ligaments attach on the other side to the bone. So the ligament is like the glue that's keeping the teeth in the jaw. If you have disease of the ligament, then you have loss of attachment. If you have disease of the cementum, then you have irritation and you're going to have an issue with attachment because the ligament can't attach to cementum that isn't healthy. Does that make sense? Okay, I'm seeing some nods, that's good. So another slide, again, there's going to be a lot of pictures of teeth. Again, this is just a quick review of the anatomy to make it. So we've got the chewing surface of the same tooth and then the tooth turned sideways. The white material is the enamel. The dark material is the dentine. What should be yellow but very quickly discolors because of the stains from the diet is the cementum. And then down here, the red stuff, this is your periodontal ligament. Also in this tooth, we have a problem. The red line here is showing, so this is where the tooth should finish. And because this donkey doesn't chew normally because of pain, we've got loss of ligament here, and we've got shortening of the tooth root here. Because that doesn't happen, we get what we're going to talk about later, which is called a malocclusion. And all a malocclusion is a mismatch in wear versus eruption, which in English just means you start to get changes in wear and you get these funny shapes or overgrowths on the teeth. So the tooth should look squared off like that, and it gets this ramp structure here. That's all we mean when we talk about a malocclusion. This one is also from an early veterinary text, and it's showing you the blood vessels and the nerves within a horse's skull. So again, this is from around 1900, the year 1900. And I put this in because it's really, really important, because if you look at each of these teeth, you'll see the blood vessels and the nerves going into the roots and running through the teeth. All mammals share the same nervous system, right? So all mammals, our teeth are innervated by, there are 12 cranial nerves, 12 nerves that innervate different parts of the head. And all mammals take the innervation of their teeth from the 7th cranial nerve, the trigeminal nerve. So it's a very important point because it's quite common to hear people discussing that the nerves of donkeys' teeth or horses' teeth are different from ours, that they don't feel pain, that, you know, you can't damage them, those types of comments. And it's simply not true. It's just not true. So you'll see me repeat that point a few times because it's so important. Again, this is a cheek tooth. It's fractured here, which is why it was being removed. It's from a very young, this is from a horse, I believe, from memory, but young horse or donkey, doesn't matter, same thing. And we've got a healthy nerve coming out of this root, but we have no nerve tissue coming out of this root. When we look in here, you can see the discoloration, which would suggest the disease in the nerve. And the other thing that you get to see when you see teeth like this, obviously I do this for a living, so I'm very much a tooth nerd, but this is a young horse or a donkey, because when we look at the development of teeth, that happens much longer than just eruption. So you'll see we've got a very, very thin, wafer thin plate here. That's going to be enamel. And as this horse or donkey ages and matures and the there'll be continual development of roots, and that area will thicken, and therefore you'll see, like the tooth that I showed you a couple of slides ago that was cut in half, that canal that contains the nerves and the blood vessels is going to get much, much, much smaller, much narrower. So this is actually looking up onto a screen. There's a camera inside this animal's mouth. Part of a tooth has been removed. You're looking down at the bottom jaw. That's why there are two roots here. The tooth is broken, the root tips are retained, and you can actually see the nerve poking out of the remnant fragment of root here. Again, just to give real world examples and you know, try to make it as realistic as possible. So where all this leads to is you're looking at a really close-up shot at the chewing surface of a horse's cheek tooth. That's what that is on the screen. And because it's close up, I've put some labels in there. So we've got the yellow, which is the cementum, the white, which is the enamel that we just ran through a second ago. The dark material is dentine, which is the material on the surface of the tooth that covers where the nerves and the blood vessels are. And it's being replaced in a healthy tooth as the donkey chews and wears away part of their tooth. Cementum and dentine are living, and that's so that it can produce more cementum and dentine. And they need to be able to do that because otherwise they would wear through the dentine and expose the nerves in their teeth to the environment and to the food. But when there's a problem with those cells, so problems with tooth eruption, problems with pressure on the blood vessels and the nerves, injury to the tooth, damage to the tooth, which is iatrogenic, which means human-made damage, so heat, vibration, those kind of things, we can damage those cells. And if you're no longer able to produce dentine and you wear through it, this is what you're going to have. So in the middle of that, there's grass, and that's because in veterinary dental terms, we call that an open pulp and a non-vital pulp. But in real world terms, it means the tooth is dead or dying. It's just like when you take yourself to the dentist and your tooth has turned brown or black and you go and have a root canal. Well, that's what's happening in these horses and or donkeys. And this is why this is probably one of the most serious conditions that you're going to come across in the mouth of a donkey. But I suppose I'm trying to highlight by having it zoomed in like that, how small this detail is and how easy it is to miss something as important as that on an oral exam. So this is a tooth. Once it's been removed, another tooth. It's been cut in half and the needles are in there because one needle is in each root canal, basically. That's what they're there for. And then next to my grubby fingernail, you'll see this long brown, green sort of thing. That's not a piece of grass. That's a dried out, dead, desiccated piece of nerve that's been removed from this tooth. So that's what that looks like when the tooth, like the one you just saw, this is what it looks like when we jump out and see something like that, and when we can get a bit further away to get a bit more perspective. The second big thing about donkeys that you need to know is the most common disease affecting donkeys. So not the most common dental disease affecting donkeys, the most common disease affecting donkeys. So more of your donkeys are affected by this disease than any other condition, and that disease is periodontal disease. Again, because we've got the ability to use the question typing bit, I might just see if you want to quickly put a number into your screens to Keith about what percentage of donkeys you think are affected by periodontal disease. Pick a number, any number, what do you reckon? Anyone not own donkeys? So if everyone owned donkeys, it's a fair question to say, pick a number, give me a number. Doesn't matter if you don't know the answer, I'm just curious. You know, is it 10% of donkeys? Is it 50% of donkeys? What do we reckon? Okay, that's cool. Looks like we got some. Now, I don't want to know who said what. I just want to give you the answer now, and then you can compare your number with the number I'm going to give you. So the number, based on different papers and depending on age, but it affects donkeys of all ages, is about 60 to 75%. So you're talking around 3/4 of the population of donkeys. So did anyone get close to that number without giving any names? We'll move
Yeah,
on.
we have one at 70.
Yeah, perfect. Okay, so someone's spot on. But I'm guessing there was a few that were probably either side of that number, so it just might be a bit of an eye opener for people occasionally.
Oh well, I put 100 because I figured at some point in the life of the donkey,
well, I can see where you were going with that, Keith. I can totally see where you were going with that. But so it's about 3/4, 70, 65, somewhere around that number. It's a very high number. And that's young donkeys. I think that's another point that people often miss and skip over. They think it's only older donkeys. It's not. This is very young donkeys. So this is a cheek tooth. We're seeing both sides of the tooth here. Excuse me. Again, it has a malocclusion. It's not flat like it should be. And on one side, it's red all over, and on the other side, it's got virtually no red. And that's because you've got 100% periodontal ligament on one side, and you've got no periodontal ligament on the other side. So when we're talking about removal of teeth, the ballpark that you look at is around 50%. So if a donkey loses more than 50% of the ligament on a tooth, it's impossible to save that tooth. Now, the problem with that theory is that, again, people, I think, aren't aware that that means on any surface of the tooth. So in this example, this tooth has 100% healthy ligament on one side, but it has no ligament on the other side. And that means this is an extraction. There's no other way to save this tooth for this donkey. That's what it boils down to. So I'm going to flick through some slides in a second, but as a summary of periodontal disease, there are 3 stages of periodontal disease. It affects different teeth in the mouth differently. It occurs in very young donkeys. And depending on the stage at which you find disease, that's what's going to determine what the treatment is that's required. So very simply, level 1 is the earliest stage of disease, and treatment is going to be a combination of routine, simple dentistry, just removing things like sharp points and malocclusions and other overgrowths, maybe some at-home care. Level 2, if it involves cheek teeth, is going to involve your veterinary dentist doing something to free the food up. And level 3 is an extraction. Those are the 3 simple stages of disease and the 3 simple ways we manage it. So this is just a reminder. I have used horses in this particular image, but on the left, we've got a fairly young horse, and on the right, we've got a fairly old horse. But again, we can interchange between images of horses and donkeys for this. That should be no problem. And it's just to show you that we're going to have a very long tooth in a young donkey or a young horse, whereas a very short tooth with long roots in an older horse or donkey. So these teeth have a lifespan, and there's constant change in the mouths of our donkeys. That's basically the point. Now this is one. Okay, so I've got 2 teeth here. Now these are from horses, but they're from 2 mares. The mares are the same age. It's the same tooth. So again, let's call the tooth on the left A, the one that has A written next to it. What I want you to tell me is, did A come out of a 550 kilo mare or a 55 kilo mare? Because that's the two, these 2 teeth came out of 2 horses. One was 550 kilos and a thoroughbred, and the other was 55 kilos and a dwarf miniature. So did A come out of the miniature or the thoroughbred? I'll show you. Well, I'll show you the miniature anyway. So this is Ella. Ella's 55 kilos, and one of those teeth in the previous slide belongs to Ella. So what I'm trying to demonstrate there is that there's an idea that small donkeys and small horses have small teeth, and big donkeys and big horses have big teeth. And by and large, it's not true. And so that means when we're talking about the dwarf miniatures or the giant jacks, that they are going to have conditions of their own. So obviously with the dwarf miniatures, we're making their heads very, very small. And that is going to lead to some dental issues because their teeth are actually still very, very large. And that's not an issue all of the time, but it's something we do need to consider. You know, Ella's a lovely little pony. She's a patient of mine. She's got a great personality, but her dental issues are largely due to her size. So, moving on. anyone that's been around donkeys for some period is going to be familiar with the idea of dentistry removing sharp points. This is what that looks like when you get in there with a really good look. These are sharp points. Its teeth have these enamel points on them. And this is the type of damage that it can do to the soft tissues in a donkey that's not chewing correctly. So I think you can see with a close-up view just how much abrasion there is on this cheek and how sore that's going to be. So there is very much routine, quote, routine care for donkeys is very important to their comfort and their welfare. They won't show much from the outside because despite them being much more perhaps sensitive on general, not all donkeys, than horses, they're still going to be pretty stoic about this stuff in my experience. So now I wanted to cover periodontal disease, so I wanted to show you what it looks like. And this is as close as I can get to a normal set of gums, right? A healthy set of gums. So we've got these nice pink triangles that sit down between the teeth. That's the point of this slide. That's what you're looking at. Then we go to this slide, and you can see that once we start scaling off the bacteria, you can see the bleeding, you can see the loss of gum, you can see the food. This is what we're talking about when we're talking about periodontal disease in the front teeth of donkeys. And this is where we're going to be doing that level 1 care. Very, very common. It won't look like this before your exam, but this is what it actually looks like once we examine it. In the cheek teeth, again, very, very common to have spaces because these teeth are under constant pressure and movement, and you get food in the spaces. This is what's called a closed valve diastema. Diastema just means gap. You know, where we put the bit, if we're riding or driving donkeys, that's called a diastema, just means gap. But it's called a closed valve because it's narrower at the top than it is at the base. And that means that while the food will get in, it will really struggle to get out. And it's not the food per se that does the damage. The problem is that as the food sits there, it grows bacteria. The bacteria, there's fermentation occurring. And so you get the production of enzymes. And the enzymes are what do all the damage. So if you think about it, in your laundry powder, you've got enzymes. You've got enzymes because they break stuff down. And that's what they do here. So there's only several things for enzymes to break down in the mouth with periodontal disease. And those things are all things we want to keep. So they can break down the gum. They can break down the ligament, as we saw. They can break down the bone. And they can do damage to the tooth. So everything that they're going to destroy, basically, we want to keep. This is just a schematic to try and, you know, hopefully just make that a little clearer. So we've got a couple of pictures up top. You can see some of the food close up between some of these teeth. You can see the color of the food. You can see how tightly packed it is between the teeth. You can see the bleeding, which starts straight away. You might notice that this gum is a different color here, and it's actually receded away from the teeth. And then down the bottom here is what I was showing you before with the picture. With teeth, with cheek teeth, they're not, unless an animal's abnormal, they're not in a straight line. They don't come up right next to each other. Each tooth of the 6 teeth in an arcade is angled differently. So the very first one is angled the most steeply towards the back, and the very last one is angled the most steeply towards the front, and everything in between. And so as they hit each other, there's obviously an angle produced. And that's when we can get this food trapping. And then as we get that food trapping, you can see the red line here, which is indicating over time we lose bone and we form a pocket. And as that pocket is formed, it fills with food. And then obviously it's a progressive process to lose more tissue. This is what it looks like again in the mouth from the top jaw. We've got a probe there, and that probe's about 44 centimeters, 40 millimeters long. And you'll see in a second, it just disappears. So if you've got a probing depth like that, then obviously there's no hope of saving that tooth because that's 4 centimeters of ligament loss, whether there's a young donkey or an old donkey. But that's okay. What we need to do in that case is to take some x-rays and do some teeth removal. And donkeys, just like horses, will cope very, very well without those teeth. The teeth are already compromised. They're in a lot of pain. They're not using them very well anyway. Again, this is a mouth. It looks pretty good up the top here. What I'm going to do now is I'm going to show you a second picture of that same mouth where we can actually see up into the cheeks here in the hidden areas. So you can see once we get a better look around the mouth, you can see all that calculus, which is what this material, I'll use my mouse, sorry, I'm used to being able to point. This material here, if you can see the cursor, and when we scale it, see how the gum has receded, the color has changed, it's bleeding. So in what looks like a pretty healthy mouth from the front, pretty healthy, well-maintained mouth, the periodontal disease is often hidden. It's not immediately obvious. You really have to have a good look around in here and find this stuff. And if we find it, we can fix it. That's the key point. I mentioned malocclusions earlier, so I wanted to kind of show you a few of those. So here we've got 3 different types of malocclusion. We've got this one here, we've got this one here, and we've got this one here. So these types of malocclusions occur generally when you have a missing tooth, an abnormal tooth, or an extra tooth. That's usually why these are going to occur. So here we will have a donkey that's had a tooth removed, or a fractured tooth, or a tooth that's what they call dysplastic or abnormal on the bottom jaw. So over time, the tooth on the top jaw, because it keeps erupting, is going to get longer and longer. And again, if the earlier that's picked up, this could just be managed as part of routine dentistry by just having this reduced. But with the important caveat that all teeth have nerves in them. So we have to do that with some knowledge and some care. We can't just go in now and cut that off or grind it away, because if we do that, we're going to expose the nerves or cook the tooth, and that's going to lead to that pulp exposure. And some of this is anatomical. So, you know, for example, in this horse here, it's actually got an extra tooth, an entire extra tooth. And this one is a horse rather than a donkey. But it doesn't matter. It would be exactly the same. And because that hasn't been detected earlier, you can see just how long this tooth has become. So the average rule of thumb is about 2 to 4 millimeters a year of tooth eruption, just to put this into some kind of time frame or context. So I'll move on. It's not an unusual question to get asked if donkeys get cavities. They certainly do. In fact, donkeys in areas like the Middle East, where they're sometimes fed dates and things en masse, fermented feeds and things like that, that does have an effect on their teeth. So donkeys do get cavities. This is what caries or cavities can look like. This is the chewing surface of the last cheek teeth, and the black areas are the enamel. So the black areas should be white if they were healthy. And then you'll also notice that even though this has been cleaned very thoroughly, we've got a lot of food stuck to everything. And that's because with decay, obviously the tooth surface that should be smooth is now rough. And so it's a very good surface, like sandpaper, for making things stick to it and bind to it. And that sets up the, you know, the bacterial environment, the oral environment. Just flick past that. This is a really important disease. This is what this slide shows. The condition, some of you might have heard of it already, has a long name. It's called Equine Odontoclastic Tooth Resorption and Hypercementosis, or just EOTRH for short, because we had to make something with such a long name. It's a disease that it generally is going to affect your older donkeys. It's an immune-mediated condition. That's, you know, something in their bodies triggers their immune system to attack their teeth. We don't know what those triggers are. There's been quite a bit of research done on it, but we don't know what the triggers are and why this happens. But if you look at this slide, you might notice that's pus there. We've got another point there where pus is draining, another point there where pus is draining. So the kind of histories you might have on your donkeys, or the things you might see with them, if they're affected by this, you might be coming to talk to your dentist or your vet because you've got a donkey that seems to break one or more of these front teeth, or a donkey that maybe pokes its tongue out a lot. Or if you're really good at looking at their muzzle, you might notice their muzzle looks a little bit swollen, and that's because a lot of the time they'll actually rest their tongue between their front teeth because they're so sore, it gives them some relief by putting their tongue in there as a pad. The only way to really diagnose this condition properly is with x-rays, and that's because most of what's happening in the teeth is happening inside the teeth and under the bone, and it varies from patient to patient as to how they're affected. So some donkeys get more of the odontoclastic tooth resorption side of the disease. So that's where their teeth dissolve from the inside. And some donkeys get more of the hypercementosis, which is, if you think back to the bit earlier when I showed you a tooth cut in half and I pointed to the root and showed you how it sort of had thickened like layers of an onion, that's hypercementosis. So basically where the body lays down more and more cementum in response to an infection or inflammation. And so this disease causes both of those things, dissolving of the tooth and reaction in the tooth, and then it just varies as to how much. This is some x-rays of this disease of the front teeth, which is generally it's going to affect the front teeth or those canine teeth. It doesn't generally affect the cheek teeth. So here, where the arrow is pointing to, we have a big resorptive lesion, so the dissolving of the tooth. And then over on this slide, we have a really big cementotic lesion, so this extra cementum, hypercementosis. But like I say, the history of these that quite often will present because you've got a donkey that seems to be breaking some front teeth unusually, usually an older donkey, might have those little pustules I pointed to, little red dots or pink dots on the gum, might rest its tongue between its teeth, or you just might think its muzzle looks a little tiny bit different, a little bit thickened. So I'll just go back to this slide. There are a lot of slides, but I will try and show this previous one. Some of you, again, will have older donkeys. That's why I wanted to put this in. So Cushing's disease, or hyperagenocorticism, is a metabolic disease. It's a tumor, as I'm sure you know, affecting a gland in the body, which affects hormone production. But one of the things that's often not talked about with Cushing's disease is that it really affects wound healing, and a lot of those wounds occur in the mouth. So this is a mouth of an animal with Cushing's disease, and you can see we've got this ulcer on the cheek, ulcers on the tongue, ulcers up here. All of these are due to the Cushing's, and so removing the points and things in the mouth is important. But if we just removed these overgrowths and points, these wouldn't go away. We've got to have this donkey medicated as part of the strategy to control the Cushing's. Otherwise, just floating the teeth on its own won't fix the disease. And the next slide is also Cushing's, and it's just a reminder. So this tongue, this lesion on the tongue here is caused by Cushing's. And again, we've just got to have it doesn't have to be a long period of time to look around in these mouths. We've got to have a really good look, because if you don't move that tongue back and have a look in that one spot, you're not going to see this lesion. Then we're not going to put the donkey onto some sort of Cushing's medication. And this lesion just isn't going to go away. It's not going to get better. So, you know, these things hide, basically, is the message. Tumours. Donkeys get tumours. This is from another, not the other donkey called Clyde. This is actually another donkey called Clyde. There was a bit of debate with the owners. There was a bit of a joke about whether he was a ponky, you know, which if a mule is a ponky is a, you know, a pony cross donkey. But Clyde had a tumour, and this is the tumour in the roof of his mouth. It's a particular type of soft tissue tumour. It's called a Fibrosarcoma. And this is some of the tumour on a slide from the laboratory and the cells. And I removed this tumour from Clyde. And fibrosarcoma doesn't carry a very good prognosis, but this is the same area in Clyde's mouth. And Clyde is 5 or 6 years now, still going strong. No evidence of tumour recurrence. So donkeys do get tumours, dental tumours, and there are things we can do about them, depending on the type of tumour and how quickly we see it. Look, I guess there's a couple of slides I wanted to show you, and the point of these slides really was just that science is about evolution. Things are going to change. The things that I'm going to talk to you about tonight may not be the things that someone else is going to talk to you about in 10 or 15 or 20 years. I don't know. So, you know, this is a real ad from a major company in the US at the time for cocaine tooth drops for kids, you know, because that was thought to be a good way to manage dental pain in children. You know, so things change, you know, we move on, and not everything that we thought was a good idea in the past we see as a good idea in the future. Which brings me to my next slide. So this is a photo from about that same era, and these gentlemen are doing some dentistry. And there's a few things wrong with this image, which I'm not going to go into. I'm just going to talk about one point in this image, just one. That. right? It's called an oral exam, and it's called an oral exam for a reason. And that's because whilst you can feel things you can't see and you can smell things you can't feel, you have to use all your senses. One of the very important senses you must use is your eyes. So if you see dentistry being done like this, you should be asking some questions about why that is the case. Because I certainly don't have eyes in my fingertips, and I could not do an oral exam like that. So this is some early dental equipment from about the 1900s. Again, I put this in because some of the equipment we use these days does look a little bit like this, but generally, again, I guess you want to look at the equipment and ask questions about why. This is the only slide I'm putting in about this. It's not unusual to hear that veterinary dentistry is a new thing. It certainly is not. Again, this is a photo from about 1860 somewhere, and you can see that this guy was a veterinary dentist running around doing dentistry in the US somewhere. So if we start looking in there, then there's lots of really interesting stuff. This is Ruby's token effort in contributing to this, Chase, by the way. She's in here. So if we start looking, you know, that's what everyone wants to do. Once they see in there, everyone's crowded in, they're all trying to see what's happening. It's interesting. There's a lot going on. This is the little movie that I mentioned earlier, and I don't think it's going to work in here. What I might do is not worry about it too much, to be honest, because you're a small group and Chase and Keith both have a copy now. So I think they can just share it to the group at some point and you can view it if you're interested. It's a short film. It's from the 1930s. It's an excerpt from a much longer film, which if you're interested, you can actually watch on YouTube. It's all in High German, so you may want to watch it with the sound off. I don't know. It's a teaching film about dentistry in horses, made at the vet school in Berlin pre-World War II. And the excerpt from here is actually just about 30 seconds or so. And it just shows them going out on a farm and setting up their veterinary equipment and doing a dental exam. And, you know, if you're interested, I'd have a look at it. I think it just, again, makes the point that what we know has changed a lot. And but equally, there were some very good things being done with dentistry, you know, 80 or 90 years ago. Just isn't always widely known. So back to perio. Remember, it's the #1 disease affecting donkeys, so we can talk about it ad nauseum sometimes.
I can smell that photo.
You can smell that photo, exactly right. That's exactly the thing. So you've got fresh grass on the right and very much not fresh grass on the left. And once you smell that smell, you will never forget it. Back to the donkeys. This is Clyde, another Clyde. Must be a popular name in the donkey fraternity, or I just happen to meet a lot of Clydes. I don't know, but his name really was Clyde. And I met Clyde because I offered to give him a free dental. I offered to give him a free dental because I was having a day off, and the people I stayed with took me on a tour of the town, and the town was very, very small, and they had some friends who had this donkey named Clyde, and they were away, so they were feeding Clyde, so they introduced me to Clyde, and I said hello, and he was very friendly at the time, and I had a look at his front teeth, and it was obvious that he had a dental problem. So we went back to their house, and we rang their friends, and I said, listen, I'm in town, and your donkey has a problem, and I'm happy to go back and have a look at him for you. And they said, sure. So I went back across the tiny little town. Was Carcoar, if anyone knows Carcoar in New South Wales, which is near Orange. Backed my trailer in there. It took me 45 minutes to catch Clyde this time. It took a lot of catching and coaxing, and then it turned out Clyde actually needed a tooth removed, so I ended up doing a free extraction, and that was Clyde. This is Clyde's mouth. So remember, this is a donkey living in the middle of a town, happy as Larry in terms of, you know, he's fat and he looks good and people feed him every day and they love him. Clyde has what's called a unilateral shear mouth. So this side's normal, this side's not. And horses and donkeys, remember, I haven't gone into it, right? We've got, you know, a little bit of time to talk about a good, fun subject that's actually quite complicated. So the textbooks on veterinary dentistry are the size of a phone book, an old-fashioned phone book, right? And we're going to talk about it for now. So obviously I'm skimming over a lot of stuff. But you've got a hypsodont tooth, which is the type of tooth that a donkey has, which means it's a tooth that keeps erupting and wearing away, not growing, not really, but erupting and wearing away. So if you're really, really sore and you change the way you chew, which is what's happening, Clyde's really, really sore. So donkeys have a lot of, ability in how they move their jaw. So what Clyde's doing is he's chewing as much as he can just on this area here. And over time, that means this side of his jaw, this bottom bit here, moves very little. So he doesn't wear away this area here, and he really wears away this area here. And that's what happens. The arcade, so the set of teeth, I keep pointing at the screen so I think you can see and you can't, so I'll use the cursor. The set of teeth gets steeper. So that's a chronic change. And the problem in Clyde's case is this tooth here. That's the one that had to come out. But then we're left with this other chronic issue, which is that his teeth are, think of it like a club foot, a donkey with a club foot or low heels or something. Like once you've got that change, it's a chronic change and it's still got to be then managed. It's the same thing here. But the primary thing first off is to take the tooth out, which I did. And that's it there in Clyde. I stumbled on these photos the other day. Another donkey. This one looks a bit happier than the donkey I showed you a bit earlier. It's the same donkey, I think, but it's now got drugs on board. That's the difference. So another key component to dentistry in donkeys is lots of really good drugs. Keep giving them drugs till they come out of those big ears at the top, right? They've got to be happy. But the other thing you may not have noticed about this donkey is, or maybe you did, can you see that it's got this asymmetry through its face? If I create a false line there, can you see that? So that's really, really common in horses and donkeys, and it's not always an issue, but a lot of them will have varying degrees of this asymmetry. So this nose is twisted over here. If you run a straight line through it, you'll start to see it. And that means its teeth are also not going to line up. And I'm not going to spend a lot of time on that. It's just something to think about. Little donkeys. Little donkeys. Do lots of little donkeys. And again, this just brings the point that, yes, the gear fits onto little donkeys. Yes, little donkeys are like little Ella, the little pony. So little donkeys have big teeth and sometimes big attitudes. This is Simpson, if I remember correctly. Big teeth, big attitudes, lots of drugs, the gear fits. That's about all I've got time to say about little donkeys. Little donkeys. Again, lots of little donkeys. So you'll see, again, we use a light, speculum fits, we give them somewhere to hold their head. And remember, Ella was 55 kilos. And this little guy is 63.5. So we are talking same. Remember, we can interchange horses and donkeys. It really doesn't matter. Another donkey. This comes back to my point about handling of donkeys. And this is something you guys understand, but it is an area that can be challenging when you're getting people to come and look at your donkeys because they don't always understand. So here we've got a donkey that's bright and alert, but we've got our ears up and forward. So we don't have, in this image at least, a particularly stressed looking donkey. And that's a challenge because they do find dentistry and oral exams, some of them, quite stressful. Back to the gum disease thing, because there is so much of it. Again, with the bleeding and the probe. Another donkey. This donkey, this is in Swan Hill on the border there, and he's only 4. And he does not find dentistry stressful at all. He's a very, very well-handled donkey. He turns up in his float, gets straight out of his float, has his drugs, walks straight in. I'll call him atypical. A lot of donkeys are going to bray during dentistry. They put their ears back. They do find it stressful, and that does need to be managed well with lots of drugs and good handling. That's my point. So I'm not going to worry about that one. We'll go back to it. Sorry for the dizzying. Right. The point of these next couple of slides is I'm just showing you the same mouth and I'm just giving you a better view. So this is our first view, right? So the mouth's open, there's a bright light, the mouth's clean, and you might notice this area up here doesn't look right and there's some food here. But otherwise, it probably doesn't look that bad. But if we zoom in and we get past this pesky tongue, then we might start to see this food here and this tooth that's sitting over into the tongue like that. Can you make that out?
Yeah.
I think I've got another slide that gives you a better look. Yeah, okay. So you really got to dial down to look at this stuff. And what we have here, this is periodontal disease. This tooth is displaced because of it. That's why the food's there. that needs an X-ray, and in fact, it needed to come out bilaterally in this little Jenny with her little baby at foot. This is the other side of her face, and this is why the other vet referred her to me, because she had the straining tract. But external signs like that are not that common. So you can't wait to rely on the fact that something on the outside will tell you there's a problem on the inside, if that's helpful. And taking these out is not easy. It's an average of about 4 hours to take a tooth out like that. Obviously, there's lots of degrees of difficulty and difference. There are teeth that I take days and days to take out and teeth that come out in 30 minutes, but 4 hours is about the average. Again, another little donkey. That's the tooth you saw in the other slides, just to give you an idea of how big the tooth actually is compared to what you see in the mouth, and also to give you an idea of how big the tooth is compared to the size of her head. So this is the donkey from, the couple of slides. That's the one that was sticking into her tongue. This one, I put this one in because it's one that maybe you wouldn't necessarily have thought of. So you've got some gum disease, what we call a periodontal pocket here. So you can see the bleeding, and you can see I can't do it for you with this, but just imagine the mirror wasn't there for a second on your image, and you can probably see without the mirror, you would really not see a very good look at that pocket. But it's what's causing the periodontal pocket that I think is interesting. So I'm going to go to the next slide. So I don't know if you can make that out, but there's a little thing there just above my cursor. It's a bot. It's a maggot's bum waving at you. I'm glad you looked in nice and close there, Chase. I saw you leaning into the screen to get a bit of a look. All right, so it's a maggot's bum. That's what it is. It's a bot, Gastrophilus intestinalis. And the next slide shows you all the maggots that were in that same hole. There were 6 of them in there. So the point is, again, on these subjects that don't get talked about. So, people talk about bots, and they talk about the importance of worming for bots and scraping the bots off the legs of the donkeys and, all that stuff. And that's really important. But what they probably didn't tell you is the life cycle of the bot. Part of the life cycle of the bot is how they mature into these different larval stages. We'll call them larval stages instead of maggots. People are usually more comfortable with that. So when they eat them on the grass or off the hair on their legs as eggs, then they ingest them, they put them in their mouths. They hatch out of the egg into the first larval stage, because it's nice and warm in there. They go across the tongue and burrow through it, and then they burrow into the gums, where they spend some time and mature into the next larval stage. Then they come out of there, go to the back of the mouth. That irritates the donkey. They move their tongue and they swallow them, and they go to the stomach. So part of the life cycle of the bot is that they spend time in the tongue and in the gums of the donkey, and that causes damage. This is actually a young horse. I'll fess up, this one is a horse. But it's a young horse that's just come back from the breaking in process. And you can see that its cheek is very, very damaged. Lots of angry blood vessels. And the reason that this horse did this was this tooth and this sharp point. That's all it is. So, it's very simple, but equally it's very important. And I know I don't have to tell you guys this, but if you're mouthing a donkey, then obviously you want to take care of this first. Don't wait until after you've done the mouthing, because they are sensitive creatures. Tooth fracture, it can happen as part of a dental exam, especially in your geriatrics. That's what this is. That's a tooth that's split in half, just as the animal's chewing on the speculum with these, because you've got enamel, cementum, and dentine, but as a tooth ages, you don't have much enamel. You just have cementum and dentine, and those tissues are weaker. So older horses and donkeys are much more prone to fracture. There's another donkey.
Susanna.
There's another donkey. Hello.
Shinto.
Shinto. And Shinto presents a couple of interesting aspects of the donkey. But we'll move on to this one. I think I've made my point about this throughout this, so I don't want to labour it. But basically, I wanted to talk about what common signs were of dental pain in donkeys. And so this next slide is going to show you the most common sign of dental pain in donkeys. Absolutely nothing, right? Bunch of relatively happy donkeys, just, excited about the fact someone's driven up the driveway. That's the most common sign of dental pain in donkeys. They're not going to show you all the stuff I just showed you unless they've got a massive external flashing light like a draining tract or a swollen cheek or hanging their tongue out. But Generally speaking, they won't let you know there's a problem. Now, this is a horse, but I put it up because I wanted to show you one of the signs that you might be able to see, and it's called quitting, and maybe some of you have seen it before. So it's this area here. All right. So if you see a donkey pouching with a swelling on its face like that, and particularly if the swelling goes up and down at different times, it's probably food. It's one of the simple tests you can do, actually. If you massage on it and it goes away, or you put some water in that goes away, it's food. And if it's food, the donkey is quitting. And a bit like Clyde with his shear mouth, donkeys are pretty smart. And what they're doing is they're putting the food in there as a bandage to cover the sore spot and give them some relief. So I'm just going to show you quickly inside the mouth. So this is the same horse that you're seeing. This is the actual photo. And you can see this food up here. And that's what you were seeing on the outside. So it's a Band-Aid off this sore tooth here. And then this is that food after it's all been removed and the teeth have been removed as well. Anyone know what this bath plug thing is over here?
Yes.
Yeah, I'll move on. Dropping feed is another one. You know, if you do have a donkey that really, really spills feed, or perhaps has a lot of grain or undigested food in its poo, then that's a potential sign that you have a problem. And then we get to stuff like this. Now, this is one of those canine teeth that we mentioned earlier. It has an open pulp, so an open nerve, and this is pus, obviously. But the reason you're able to see the pus is because I've put a needle into the tooth and I've injected air into the tooth, which has forced the pus from the bottom of the tooth, where it would normally be, up and out of the tooth. So the tooth would not look like this in normal day-to-day. It's only like this because we've artificially made it look like this so you can see what's happening on the tooth root, basically. Another one is this, which you could definitely see in your donkeys, which takes us right back to where we started towards the beginning. So there's a few issues in this slide, but if you think about it this way, does one of these teeth not look like the others? This one? Can you see that it's brown and that the gum is more exposed? So this is a tooth. There are several teeth in this slide with what's called an exposed pulp. That one has one as well, that black circle. But this has an exposed pulp, which you remember is just dentist for a dead nerve. And just like when we get a dead tooth and the tooth starts to get bacteria in it or bleeds, then the tooth will discolor. It'll turn grey or brown or black. And then you would go off to the dentist and they would usually send you to an endodontist and you would have a root canal and then you would have your tooth bleached because no one likes to walk around with a black tooth. In donkeys, it's more practical to remove the tooth as a general rule, but we can do endodontics in some situations, but it's much more practical, cost effective and better for the donkeys, I believe, to simply remove the tooth. Again, just a different perspective showing that we can show that this canal is open. Again, I think this is just going to show you, yeah, I'll just go back to that. So again, this is a mouth that's, you know, you're seeing the whole mouth, it's bright, the points are gone, things look pretty good. But if we pick the eyes out of it, there's some serious problems here. So we've got cavities hidden down in here, we've got food trapping here, and we've got a dead tooth right there. So again, it's just about going through and picking the eyes out of these donkeys. And in some of these donkeys, there are going to be serious problems. If we do have to remove a tooth, there's not a lot of room in there, which is what this photo is just showing you. It's just giving you an idea of how limited the space is, how short the crowns can be. And then, yeah, see, this is another one coming out. Just gives you an idea of space. That was the point of this slide. It's not meant to gross you out. It's just meant to give you an idea. It can be a tight fit. And this one here is coming out of about a 50, 60 kilo little one. Can take a lot of equipment to do it. And it definitely takes a lot of drugs. So it's all about pain relief. These guys are done with nerve blocks, anti-inflammatories, opioids, that, you know, they have it all. I'm a big believer in pain relief. I think it would be, well, it would be cruel to do it any other way. They don't all come out in one piece. This didn't come in one piece. This actually is a 2-year-old horse, standardbred, and that was what the tooth was like in the horse's head. It had had a traumatic injury and the tooth had exploded into, as you can see, a kick to the head can do a lot of damage. This horse's tooth was in about 100 pieces. But did get it all out and it did resolve. So the only other thing I'm going to show you very quickly, because I'm very grateful for you to give up your Saturday night like this. It's another really common one, even amongst my fellow vets, that they will talk about the number of teeth a horse can lose or a donkey can lose. And so I've got some before and afters here. This is a horse, lives in the high country of New South Wales. It lives with some Brumbies. It's owned by a veterinarian. It has that disease that we talked about, the Odontoclastic tooth resorption. And these are before and afters. So this is before we took out all its front teeth, and that's all its front teeth. And this is after taking out all its front teeth. And I think you can see from the photos the kind of country it lives on. So it's not being hand fed. It's not hard fed at all. They certainly, generally speaking, cope very well without the teeth. Again, that hasn't been photoshopped. No, it looks like it. This is the thoroughbred in Victoria, had one fractured cheek tooth, and that's what it looked like about 3 months later when we took the after photo. It looks pregnant. It's a gelding. And then one last one. This is an aged mare down here on the Mornington Peninsula where I am. This pony is about 15 minutes from here. This was before I did surgery on it. This is 3 months later, and those are all 8 of its cheek teeth that it had out at surgery. We're not taking them out. I'm not taking them out because I want to. I'm taking them out because it's too late to save them. I'd much rather save them. But this is the first time I've seen this horse, in her 20s. And by that stage, that's the level of disease that she has, and that's what I can offer that owner, and that was the result. So I think it was a happy result, but I don't want to take these teeth out. So pretty much in summary, what is the message? What's required? Well, we need to do a thorough exam on these donkeys. We need to get a diagnosis wherever possible. That's really important. And then from that diagnosis, we need to work out what treatment is required. Part of that is a thorough oral exam, and that means that we need to have things like a bright light, a mirror, the right tools, and plenty of drugs. And on average, most donkeys should be seen by someone roughly every 6 to 12 months. So just bear with me while I try and navigate here. I think if I hit that, then this will go away. Yep. And then I think that frees it up. If anyone has any questions, we just get to talk to each other, don't we? Is that how it works?
Yeah. I'd like to thank you, Shannon, for that. I found it really interesting. I don't always enjoy leaning into maggot bums, but what can I say? So I just wanted to clarify, both for people that haven't used an equine dental vet, and sort of so you can elaborate. So the drugs that you talk about, like the sedatives to start with,
Sure.
they're to facilitate a more thorough examination, so the animal remains calm and still, so that you can really get in to do all of those things they're talking about with the mirrors and the probes and everything. It's not like a shortcut, lazy way of doing dentistry. It's more to just make sure that the animal's calm for the procedure. Is that right?
Yeah, that's a really good summary. That's exactly right. I think the couple of things there are, and it's probably a very hard point to make anytime, let alone sort of late on a Saturday just with pictures. But what I was really trying to do in showing you some of those donkeys, and obviously I'm not the donkey expert or the person that's around donkeys in the way that you guys are, but I do spend my professional life around horses and donkeys. So I work with horses and donkeys 5 to 6 days a week, every week. And I meant what I said, flippantly or not, that generally speaking, donkeys, I believe to be, they've got long memories and they're easily offended. So you do have to approach them with a degree of donkeyship, for want of a better term, and then the drugs are really important. The drugs are really important for 2 reasons. One, you need to do a thorough oral exam, and that's not easy in some horses and not easy in some donkeys. And it's not still going to be easy with good drugs. But the other is, I've made the point several times in that talk that all animals have the same nerves in their teeth. So any procedure we do, whether it's putting a mirror in or taking off a sharp point, is actually painful for a donkey. So the drugs we're using, there's a number of different drugs we use, but all of the drugs that we use contain analgesics, pain relief. So, excuse me one sec, I'll just close this other thing on my screen. Yeah, so does that answer you, or is that sort of the query you had, Jose? Yeah.
Yeah, I mean, I've had the benefit of, you know, one-on-one with you for 10 years, but I just wanted to, you sort of touched upon, and I just wanted to clarify, because I know people, when I explained that I use an equine dental vet and sedative analgesic care, they, you know, some of them don't really understand what the benefit is of the use of the drugs and I think some people don't realize it, but about the pain relief aspect, they think the animal is just being sedated. Yeah. They don't realize that it's actually also about managing pain. Yeah.
Yeah, and it's very true, and it's something we could talk a lot about. It's something that if you sat on it, you know, if you sat on the shoulder of someone who does it, I can tell you quite honestly that it's very obvious to me on a daily basis if I deal with particularly older horses, probably more so than donkeys, because I still do a lot more horses than I do donkeys. That's just the name of the game. It's just the numbers. But I can tell the aged patients that I see for the first time that have been done by hand over the years because of how they behave. And then over the time, they will improve. So with certain types of patients, you can make it appear a certain way. I don't really want to get into politics. I just want to try and explain the science. And that's difficult to do, again, without standing in front of a horse or a donkey and having equipment. But if I wanted to do something with a horse, I can, you know, I can use an instrument and I can make the sounds and I can make it look like I am doing a lot of work to that horse or donkey, and they will stand still. Now, I know exactly that point that if I push a little bit harder, that's going to really hurt them and they're going to react. So you have to be careful, because it's very easy to watch someone work on a donkey or a horse unsedated and for it to look very calm and very relaxed. But what you have to be sure is that what they're actually doing in there is everything that needs to be done, because that's not the same thing, if that makes sense. You can do something that looks very effective and keep the donkey calm if you know where the trigger points are that are going to make that animal react, and you don't push past them. One of the reasons we want to give them analgesics is because we have to push past those points if that's what we have to get done to make the donkey comfortable.
Yeah. And I feel like a bit with worming, you know, for a long time, sharp points have been the sort of what people are focusing on with their dentistry. Like with worming, it was, you know, large strong gauze. Now it's small strong gauze. I feel like with dentistry, sharp points are not the sort of only thing. I know you can sort of say that you can feel for sharp points, but I feel like with diastemas and things like that, you can't feel those things. You can't, you know, sometimes finding wolf teeth, they're not something you can necessarily just sort of feel, are they?
Well, there's things that you're going to feel that you can't see. There's things that you can see that you can't feel, and there's things that you can smell. You know, you have to use all your senses. Why would you, unless you were limited in the senses that you had, why would you deliberately limit what you're going to use to perform an exam? Because as I think, hopefully it was clear, you know, having a really good look at these mouths, it can be easy to miss things. So you want to use every tool at your disposal to be as thorough, as quick, but as thorough as possible, so we're not missing stuff. And that involves obviously using your eyes as much as possible. Yeah.
Thank you, Shannon. I was present some years ago when you gave a demonstration to the Donkey Society at Jack's Run, a property up north of Melbourne somewhere. Yes,
I remember I enjoyed that day very much, actually. I've been back there recently. It's changed hands and changed name, but I remember that day you had a bunch of very interesting, you even had donkeys doing dressage for the first time, if I remember correctly. There was a dressage lesson.
Yes.
Yeah, I thoroughly enjoyed that, actually.
Yes, thank you. I enjoyed the time that you spent with us then.
Thank you. Appreciate that. Well, if nobody's got any questions, then I would say thank you very much for your time. It was greatly appreciated, and I'll let you.
So if people wanted, so just one last thing, if people wanted to find a dental vet like yourself, what's the best thing that they can do to try to track one down?
There's a few different resources they can utilize. There is a website that would list some of the vets, and that's called Equine Dental Vets. It's a .com, but it's not. They don't have to be on there in order to be a dental vet. So that would be one resource. Another resource they can utilize, I suppose, is to contact some of the societies and some of the veterinary groups. I think the only thing to be very careful of, or the only thing to be careful of, is to again distinguish between a veterinarian who does dentistry, who refers to themselves as a dental vet, and a veterinarian who is a dental veterinarian. And that's pretty easy. You just ask them a few questions, ask them the right questions, or ask other people questions about them perhaps. But you know, you still need to do your due diligence. But obviously the important thing here is that the donkeys are getting a high level of care. So, you know, if you can get a hold of someone and they can help you, then that's the aim here, wherever that might be.
Yep.
Yep, for sure.
Well, thank you so much.
Great. That's all right.
Thank
No
you.
problem. Pleasure. I've put Ruby to sleep, but that's normal. So.
She's heard it all before.
Oh, she's fast asleep. She's heard it all before, a million times. Anyway, well, thank you all, and enjoy your Saturday night, and thanks for the opportunity, Chase. That was great.
No worries.
thank you.
Thanks for making yourself available.
Yeah, it's greatly appreciated. That was absolutely fascinating.
Well, I appreciate that, Kate. It's not an easy thing to listen to, I'm sure, but yeah, it's hard to try and pack in a bit of science there and fit it into a relatively short period of time, and not sort of make it too technical or hopefully make it too boring. So, yeah.
I think you pitched that perfect.
Yeah.
It was good. It's just the right mix.
Right. All right. Well, thanks again. I'm going to disappear, and yeah.
All right. Thanks, Shannon.
Cheers.
Thank you
See
very
ya.
much.